everyone. This is Dr. Mary Lauder, and you are listening to the Since You Put It That Way podcast. It's the show that examines various health, wellness, and medical topics from unique perspectives. We will be having discussions and guests that will cause you to pause and consider, well, since you put it that way. Hi, good day to you. This is Dr. Lauder, and welcome to another episode of Since You Put It That Way. Today, our guest is going to be Dr. Alicia Williams, who is a holistic cardiologist and has a practice in East Lansing, Michigan. Before we get to her and before we get to the introduction, I'd like to share my screen and show you a community that I'm developing. This is really important. This is the Karen Wellness Institute or Karen Wellness Community. And I'm signing in myself here. But I want to show you what we've got cooking and why that this is important. We've developed a platform where you can get all things wellness. Really, that's from my heart to yours. And we've got sections over here on what the home section is, the Boston Heart and Karen Cholesterol Panel, initiating the Hero's Genome, which is our genomic testing, genomic modules, areas where you learn and areas where you can come together and communicate about genomics and how that interfaces and influences your health and your life. And we've got an Adventurers and Ascent Club. These are clubs that you can join for coaching. This is coaching in the health and wellness area. And right now I'm leading these, and as we grow, we'll be adding other health and wellness coaches, but I'll always be overseeing and keeping an eye on things. And this is an area where folks really dig into lifestyle changes, really dig in and make the changes stick and work. And I think that this is important to have a community like this because it's a safe space, number one. It's a space that I've created to communicate from my heart, my philosophy to yours. Every day people say to me, I don't know where to start. I'm tired of my doctor not listening to me. What keeps me up at night is not knowing if I should do a statin or not a statin. Am I high risk for heart disease or not? Because I don't get it. Also, I get a basic panel for cholesterol. And when I have more questions, they're not answered. I don't understand what diet to use. I don't understand how to exercise. And then there's the noise in the social media world. There's the noise in the magazine world, in the online world. All these things are good ideas, but are they good ideas for you? And that's the burning question. That's the problem. How do you solve that problem? We solve that problem by our Hero's Genome area. And in the genomic area, you can become an explorer, which costs no money, and you look around. You can initiate and do the Hero's Genome course, which many people have done. And we've got an Adventurers Club, which includes the Hero's Genome plus some monthly coaching, and the Ascent Club, which is the Hero's Genome plus weekly coaching. So that's more intense. Now, when we do the coaching, you're in a group. Why? Because the group creates what's called a vortex. The group creates group think and coming together around shared ideas, concerns, and problem solving. And people tend to get ideas from other people. People tend to grow. People tend to communicate. And that propels people down their path and their journey much more quickly. So this is the starting point for all things health and wellness is genomics. And I've left the traditional world, even the traditional world of functional medicine, to go into the genomic arena and use that as applications for all things for health and wellness, recovery of your health, restoration of your health, establishing your health, something that may have occurred after getting an initial major diagnosis, or anti-aging, because what's that really mean anyway? I don't know. I don't know that that's a thing. That's like saying anti-gravity. Well, you can't really be because gravity is and aging is. But how do you get that trajectory of longevity, good health, wellness, happiness, contentment, emotional well-being together? That's the goal of all this. So I'd like you to come to this space And there's a link on my webpage to get to this. There's a link in the newsletters if you're on our newsletter list. There is a link with the podcast, and there is a link. I think that's all the places where the links are. And what you do is you click on there and it brings you to sign into this page and to sign into this community at no cost. And then you can begin your exploration. So this is a place where all things wellness is happening. This is where my heart is really shared to yours as a physician. And this is where you can really, really enjoy your health journey with others, led by myself and my staff. So I invite you to check this out. And this again is called the Karen Wellness Institute or Karen Wellness Community. So now back to our usual programming, which is the Since You Put It That Way podcast with our special guest today, Dr. Alicia Williams. Hi, and welcome to the next episode of Since You Put It That Way. Today, our guest is going to be Dr. Alicia Williams. She is a cardiologist. She's a holistic cardiologist, and we're going to discuss about all things heart as we continue on in our series here of maybe the summer of loving, because it's the summer and we're loving our hearts, or maybe just all things about heart health, however we want to take this, serious or not. So Dr. Williams, as our guest, she's been a cardiologist for 30 years, and she's been a holistic cardiologist and a functional medicine physician for 25 years. She graduated from the University of Michigan with her undergraduate, and then from Michigan State University College of Osteopathic Medicine as an osteopathic physician. She did her internship in Botsford, at Botsford Hospital in Farmington Hills, as well as a 3-year non-invasive cardiology fellowship at Botsford as well. And she's board certified in cardiology, internal medicine, and obesity medicine. Over the last 25 years, her training and practicing functional medicine has led her down this pathway of being what's considered a holistic cardiologist. So this is a rare treat for us to have her as our guest, speaking really not only as an expert in cardiovascular health, but really at looking at things holistically. She has cared for complex cardiology patients pretty much her whole career. And she's really interested in helping adult clients identify vascular risk and options for not only reversing risk factors, but also preventing it. To connect with her, her office is the Center for Optimal Health, and that's in East Lansing, Michigan. And you can Google her in East Lansing, Dr. Alicia Williams at the Center for Optimal Health, and find out her information. We're also going to have for you an article that she's provided for us for our listeners, as well as a list of books that she feels are important books for us to read and understand regarding cardiovascular health. So with that, we'll move into the podcast and welcome Dr. Alicia Williams. Well, welcome to you, Dr. Alicia Williams, my favorite cardiologist. And you're a holistic cardiologist in East Lansing, Michigan. And we gave, an introduction just a little bit ago, so they know where and how to find you and a little bit about you. But tell us, what led you into both cardiology and then even the holistic aspect of cardiology?
I was always interested in nutrition. That was actually the first thing I was interested in. I was one of those nerdy kids that read all the time, and my hero was Linus Pauling and vitamin C and all the nutrition, and grew up with my mom and I going to the health food stores. So I'm a little different than maybe some people, and I tell people when I see them that I could shove a whole thing of parsley in my mouth and be happy. So I know that makes me a little freaky because it might scare people. I can't do that. But I like to make it real for people. And I like to tell people that, this doesn't have to be your story. This is my story. But I knew I always wanted to make people healthy. And actually, I went into medicine wanting to do family practice. Mm-hmm. My doctor, if anybody remembers Captain Kangaroo,
yes,
my doctor looked like Captain Kangaroo, and he was the most wonderful man you could ever meet. Yeah. And I hardly had to go in. And when I did, I felt really comfortable with him. I thought, I just want to be like him.
Yeah.
And then when I got into medical school, I just loved cardiology. It was so exciting. You could do all these things. And at the time, stents weren't even around.
Okay.
People would have balloon angioplasty and you'd save them from a heart attack and septic or shock. And all these things were really exciting. And that was good experience. But then I started to go back to think, well, wait a minute. They came in and said, okay, I'm all fixed now. I had my heart artery open. And it's like, no, I don't think so. I think there's more to that. But we didn't know as much about the health of the artery wall being so important. So as I finished my cardiology training, that was the year that Dean Ornish's book was published on reversing heart disease. And I was given that copy by a fellow that was ahead of me. And I was kind of angry that I didn't learn any of that in medical school. I thought, here I was always interested in nutrition, and no one taught me anything about the possibility, even if you didn't do that program, that it was actually possible to reverse heart disease. So then I really dove into that. And it was interesting because Dean Ornish's program, he did show, and it's a reasonable group of people with very sophisticated technology, that you could actually reverse heart disease and improve blood flow. And he utilized, group support and yoga and quitting smoking and exercise and a very, very low fat vegetarian diet. And also really looking at the mind-body connection. And so I tried to get that program when I was in Kalamazoo. It was starting to expand across the nation, but we couldn't get it. They were trying to get it approved through Medicare, and it was a very intense program. And so instead I did a different program that I was just really delighted with, which was the Coronary Health Improvement Project. That was a community-based program. And it did involve a lower fat, high fiber, kind of Pritikin style diet. But it was all about food to start with and education. So Dr. Hans Deal came in and I thought, this food part is really the key. And so I became interested, and I used to tell my partners, my job is really to keep everybody away from you.
Right.
I love you to bits, but I don't want my patients having to see you.
Right.
And so because of that interest, I just became more and more interested in what could you do to really not only reverse but prevent heart disease. And now we're in such an exciting time. There's a lot of options for people, but I think we really do have to go back to the basics. So the more I get along, because I've been in cardiology 30 years now, the farther along I get in traditional medicine, the more I like to get back with basics, because that is the key for people, and also empowering people with information and really telling people, you do not want a passive relationship most of the time. In an emergency, maybe that's the case, but most of the time you have to be your best advocate. Bring someone with you, a family member, a friend. I write things down for people because I think more and more we have to empower people with the knowledge and desire to take control over their health.
Right.
And so that's been my driving force in the last several years, is doing more and more, not only holistic cardiology, but oral systemic health. So the health of the oral cavity, the gut. And then for many years, I've been training in functional medicine. So since the early 90s, and my background was biochemistry. And so when I went to the functional medicine conferences, it just made perfect sense to me.
Yes.
And so that was kind of the key, was really giving the body back what it needs,
Yes.
and taking away what the body can't handle. Those two things, simple as that. We can't change the genes, but why don't we give what Jeffrey Bland talks about? Let's feed the genes signals of bliss. And when we feed the genes signals of bliss, the genes will be more able to handle the environment. So that was my passion for many years. And I still find that I go back to that. I mean, it ruins your brain for traditional medicine. I used to go around in the hospital giving people pieces of paper towel with a book. Get this book, get this test, get these, come see me. And they'd hold on to that. And it was like their lifeline, because they knew that it wasn't over. that, getting this stent or this balloon, and that people in their 30s, when I finally backed out of hospital-based, aggressive cardiology practice, I was seeing 30 and 40-year-olds coming back for their 10th stent.
Oh, wow.
And it's too much. We're missing the boat. And I think a lot of it goes back to metabolism, toxins, foods, stress. And we're not doing the right thing for people when we don't empower them to know what they have as far as options.
Yeah, I think that's beautifully stated. Okay, we're done here. Okay, no.
Oh, that was the other thing Dean Ornish had talked about. And I found it over the years is that part of the group support was, talking about laughter and joy.
Right.
And I think one of the things I really like to do, and sometimes, in the clinic, they would come in and say, "What are you doing?" There was like rolling laughter coming out of the room. And I said, "Listen, we're busy.
Yeah,
We're busy in
exactly.
here. We're curing disease."
Exactly. We're healing.
Yeah,
We're healing.
that's right.
Yeah, I
That's
always said
right.
laughter is the best medicine, and there's really no copay. So there you go.
That's right.
No deductible. So that's always good.
Yeah.
Well, it's interesting because, they're talking now, some of the articles I'm reading, where they're really finding heart disease in 15-year-olds. And
Yeah.
what I mean is the coronary arteries, the arteries that attach to the heart, that supply blood to the heart, are blocked at 15 years of age.
Yep. We knew this when the Vietnam veterans came back and they died in car accidents. They already had fatty streaks in their aorta.
Mhm.
Now we're going to be much younger than that, and the part of the reason is obviously the food and the activity and toxins. And one of the things that has delighted me over the last 5 or 6 years is doing the carotid screenings, the CIMT.
Mhm.
And when I looked through the literature, and this is a way to screen, they've actually, I think, almost 18,000 articles now using this technology, not only to track medical therapy, what does blood pressure do? What does cholesterol medicine do? How does it help the arteries? But also in population studies, they've studied kids, they've studied pregnant women, they've studied groups and looked at the thickness of their carotid arteries, and it's not normal.
Mhm.
And that is the beginning of what progresses over many years. And so it gives us a way to know, hey, we're not on top of this. You might feel okay. You might even look okay, but you're not okay. And so that's very eye-opening for a lot of people.
It is. You mentioned food. So our teenagers, what? A lot of it's packaged foods, right? The ultra processed foods.
75% of what kids eat now.
Yes. And now the intention of that came what? After World War II, and things began to be canned, packaged in the 60s, even into the 70s, where things became more convenient. And it was a small fraction of foods at that time. And then now we have, I call them Franken foods, if they're the
Yes.
ultra processed foods, because we take components and chemicals and bolt them onto some type of food molecule and make something new. And I maintain that in our GI system, that's just not identifiable. Our
No.
body doesn't know what to do with it. And that's where the inflammation gets kicked off. That's where changes occur within the lining of the gut, and then affects the immune system, triggering inflammation.
I was just listening, I can't remember his name. I was listening to an expert because last year I decided to get boarded in obesity medicine. It's been a fascinating amount of information about the signals. And this gentleman was talking about food cravings. And he's at Yale, I think, doing research. And he said, when we get this mismatch, we get an artificial sweetener or an artificial fat or an emulsifier or a chemical attached to a food, it's not what our brain thinks it is. So it makes us want more because it's a mismatch.
Yes.
And so we think we're doing the right thing, but actually it's creating these cravings. And he said, you'd think that people would be satisfied, but actually their brain gets frustrated and makes them seek out. And that's our primal brain wants certain things. And it's really interesting how that just creates in these kids hunger, and
Yes,
they shouldn't be hungry.
right,
It's these foods that are unidentifiable to our body.
right. And that's really at the dopamine receptor, the feel-good receptor.
Yes.
So the pleasure centers, things like that, that where, people have, that's where addiction comes in, really, with all those
Yeah.
pathways. Now, as I look at genomics, we see some folks who have a higher predisposition to that.
Yes.
So for them, the frankenfoods are literally like crack.
Well, and the maternal patterns of eating and how that's passed on generational.
Yeah.
It's really fascinating. I think of how important it is, we talk about safe spaces for trauma. When does our body get a safe space? If we feed it signals, we're not allowing any safe space in our body, because we're not allowing our body and brain to get the nutrients that it needs, and also getting all the toxins. And then we end up with these bacteria in our mouth and our stomach that create inflammation. And so it's a terrifying aspect of where we're at. But I don't like to live in fear. I tell people, we need to live with joy, but health can be joyful.
Yeah. Yeah, I think that that's true. And so if we bring now the heart into that concept, what you're saying is it's not just about cholesterol. It's just not about what your numbers are. It's just not about, what your family history is. It's how can you modify those things on your
Yes.
dental health, which is really gum health, periodontal disease.
Yeah.
How is your digestion working, which is really a functional way to look at. So we're both osteopaths, you and I, so we know structure and function are interrelated.
Yeah.
And so you've got the structure of the GI tract, mouth, all the way through to the out shooting through the rectum. And all those different areas have different functions. And they're really important for us to gain nutrients, for us to avoid things from the outside getting in, because really the gut tube is going through us, but it's not in us. It's
Yeah.
in us, but
I
not
know.
in us. So it's outside of us, but in us.
And we used to think it was this impermeable, I can shove anything in my mouth and it just goes through. My husband's concept was, if I eat a whole container of ice cream, how can I possibly absorb all those calories? I said, it doesn't work like that.
Yeah.
But it's interesting now that we know the gut is not like a solid, plastic tube. It's permeable, and we get these compounds that get absorbed, like pieces of bacteria or chemicals that circulate. And we find some of those bacteria from the mouth and the gut in the artery wall. Yes. As part of it. And even things, like Lyme disease or molds. But I tell people that these triggers, and that's why I try to describe for people whatever concept that we have. Like, for example, H. pylori can trigger AFib. So atrial fibrillation can be triggered by gut bacteria. But if we consider our body as something that's getting challenged every day, like if you had a bear that was hibernating and you poke that bear with a stick, it may not wake up. But if you get enough sticks and enough people poking it and irritating it, the bear will wake up and eat you. And then you don't have to worry about, anything else. Right. So whether it's a heart rhythm thing or a blood pressure thing or a circulation thing, we have to look at what these triggers are and try to remove as many triggers as possible. And otherwise, we're having to put in medications to correct it, which sometimes we have to do. I use medications every day. But I like to have that conversation with people, say, what are you able to do? What can we help you pull off so that you don't need as much medication, but you need to be protected at this point? And so back to the cholesterol part, it's the inflammation. It's what is the cholesterol surrounded by? What are the risk factors? So as we fill the bucket with these irritants, what can we get rid of to make one less thing happen? And so we don't have to correct every single risk factor. If we can correct whatever risk factors that we can still improve risk. But if someone's cholesterol is 300 and their LDL cholesterol is over 200, and they have a strong premature coronary disease in the family, they might be eating a pristine diet. But then you've got to look at all the other things that can contribute, and they can benefit then from a statin drug. But that is a subset, and people that have had events like a stroke or a heart attack, yeah, maybe we need to use some of these medications in appropriate ways and support the body so it can handle it. And then you start to, I tell people it's a short game and a long game. So the short game is keeping you safe and not having side effects from meds. The long game is what can you get by with the least amount possible, but you have to heal and understand what's happening first, because otherwise you're just pulling a bunch of meds away and leaving yourself unprotected. So I really, I think we both have utilized, like the Boston Heart, some of the inflammatory markers, and some of the nutrient levels, like coenzyme Q10 and the fatty acid balance. Even if people don't have money to get some of these things done, can they use an electric toothbrush? Can they do some oil pulling? Can they eat a whole foods diet and do an elimination diet? Can they take some nutrients, some basic nutrients? Because most of the people that I test are low on coenzyme Q10 and fatty acids. So they might tell me I don't have money for the test, just take them. I mean, you have to sometimes balance that. Same thing with homocysteine.
Right.
So if you have someone with high homocysteine and high cholesterol, what can we get down? So it's kind of the environment. Same thing with uric acid. Uric acid crystals, somebody has high blood pressure and they have high uric acid and they're eating a bunch of refined food and sugars. Until they can tackle that, it's going to be very difficult to protect them from these damages to the artery wall unless we go back to the foods in the gut. So I usually start with the foods, the gut, the sleep, the stress. And at the same time say, okay, these risk factors are way out of control. What can we do to pull these down as we go forward? And then just keep peeling it like an onion. What layer can we work on now? And that way it's in doable pieces for the person that's coming in. Now, because what's in our brain can be terrifying to patients. It's like, oh my goodness, I can't do all this.
Oh, yeah.
What can we do right now? And let's work on food. Can you eat more vegetables?
Right.
Can you eat more beans?
Yeah.
Can you do a little bit of movement? And so those are things that they could hopefully tackle.
So do you see the difference? I mean, right now, heart disease is a leading mortality and I think morbidity statistic in the world. 17.3 million people die every year on the planet, off the planet, leave the planet because of a heart attack or stroke, cardiovascular disease.
Horrible.
That's a huge number.
Over 50% of the time, the first symptom is sudden death.
Yes.
For heart attacks. So are we going to wait for a symptom? Doesn't sound logical, does it?
No.
And so that's why I tell people, we have to wake up. We have to become aware of where we at, because if you are in the dark on this, you're losing a chance to make some big changes. So one of my real goals the last 5 or 6 years is we've got to identify the health of the artery, whether you do a calcium score or a CIMT carotid thickness test, be aware of the health of the artery, know if you're inflamed, know the basic numbers, and start eating healthy, and then educate yourself. And those things are very doable and can be cost effective.
Yes.
And so I tell people, and I have, I may have given you my book list, but there's a book, the Healthy Heart, Healthy Brain by Dr. Bradley Bale and Amy Doneen. It's a good reference book. It might be a little overwhelming at first, but when you look at that book, you realize, I could have risk and I don't know it. Their first book was Beat the Heart Attack Gene. And so that book is very invaluable. But the other book I like is the whole series Clean by Dr. Alejandro Younger. And he is a functional medicine cardiologist. And I've had a lot of people tell me they really like his book because he gives his personal story. So I think that when we give patients our personal story and we make it relatable and doable for them, and of course, my first visit is a longer visit because you just have to know what's going on, because otherwise you're kind of shooting in the dark. You know, 5 minutes, you can write a script. But if you want to really get to the bottom of something, you know, do they have food intolerances? Do they have gut imbalances? It takes that little bit of time and effort between both you and the patient to become a team and try to get to the bottom of it.
Right. So, which brings up a point. I mean, women in heart disease present differently than men with heart disease.
Yes.
Can you say a little bit about that?
Well, and I think over the years, we never thought women could have heart disease. Oh, you won't get it till you're older. And it's so wrong. We now know, especially now, because of the increasing risk of 85% of the people in the US are not metabolically flexible. So that means either insulin resistance, metabolic syndrome, prediabetes, diabetes. That's horrible.
That's a high
So
number.
we really know. And so one of the things that we thought of in the past is, yes, pregnancy can impact the heart. You can get weakness of the heart. You can get heart attacks with pregnancy because of the arteries tearing. You can get Takotsubo, which is stress-related broken heart syndrome with sudden stress. We see more what we call non-obstructive artery disease, meaning that there's just a partial plaque, and yet someone has a heart attack or they have chest pain. So could there be spasm of the arteries, or the artery wall is not functioning properly? Or are the teeny tiny blood vessels that we can't even see in the heart, are they stressed? And we treat that as if it is heart disease. So if somebody had a stress test, a woman had a stress test and it wasn't normal, and then they had a heart catheterization, say your arteries are open, well, that doesn't mean they don't have heart disease. So now we know this. And we have smaller hearts than men. So if we have high blood pressure and the heart gets crowded, it gets smaller, meaning we're crowding what can happen, and the heart can become inflexible from both diabetes, inactivity, and then we add on to that blood pressure. And so we get more heart failure in women because their heart size is already smaller than men. So there's a lot of those factors, but a lot of it does go back to hormone changes. So when women with PCOS, polycystic ovarian syndrome, have high insulin levels, or you have women that are on birth control pills, or they're going through menopause or perimenopause, we know that there's a change in heart risk. And now we know that women become insulin resistant as they go into menopause. That's why we get the little pot belly. And that's why we start to gain weight, even though we don't know why. You know, we've done the same thing as we did before. And probably some women maybe are more attracted to carbs than they are meat, because we tend to maybe eat more of those things. And then we lose muscle. And so that affects our metabolism. The other thing that can happen is more autoimmune disease. Women are more prone to connective tissue disease, which kind of prunes out the arteries, and lupus. And then, of course, airway issues. You know, if we have smaller mouths and airway issues, you can get into sleep apnea. And we used to think it was all the men with the big pot bellies that had sleep apnea, and we just know that's not the case. There's a lot of those factors. And then, of course, losing sleep because of hormone changes.
Right.
And, you know, I think about how much sleep I lost on call. I don't even want to think about it.
Right.
I mean, talk about a risk factor. It's like, oh, okay, you know, I don't need to sleep. I can just keep going.
Right.
Yeah.
So, yeah. So that, I mean, looking at that, because even when women go into their cardiologist or their family doctor, let's start there. They go into their primary care doctor and they're around menopause, or they're just menopausal, and they present the very things that you just talked about. Gosh, I put on weight, can't seem to take it off. I don't seem to have the same stamina. There is not, I promise you, there's probably less than one hand of people that are thinking heart disease in women.
Right.
saying you're overstressed, you're doing too much, it's all in your head, what's wrong with you, things like that. Those are the messages people get when they go to see their primary care.
I think in both men and women, but I think we didn't necessarily notice it as much in men, but fatigue, especially with exertion, is one of the first things that my spidey sense goes up.
Mhm.
Everybody thinks there's going to be this elephant on their chest,
Mhm.
and that, is like such a small percentage of people.
Right.
It can be pressure, it can be in the pit of the stomach. I had someone tell me it felt like they had mashed potatoes in their throat, or dizziness or palpitations, and it may not be a heart attack, but it may be your body just giving you that signal, waking up, feeling panicky. All those things become really important to discuss with your provider. And I had one young woman, unfortunately, when she was 29, went to 5 different emergency rooms before they did an EKG.
Oh.
And she had a heart attack 5 days earlier. Now, that was many, many years ago, and hopefully we never see that happen again. But her family history was very strong, and no one even thought that this crushing chest pain could be even a heart attack in someone that young.
Mm-hmm. So you mentioned the fatigue because women are tired all the time for the very reasons. Lack of sleep because of hormone changes, family,
Yes.
they're often sandwiched between taking care of children and their aging parents. So how does a woman identify that? Is it fatigue while they're exercising, after they're exercising? What have you noticed the most?
I think by the time they come to see me, they're already worried about something. They know something's not right. So I have kind of a pre-selected group of people that are coming in, and I have a very low threshold, at least get an EKG. I can't tell you how many people I've seen over the years that have had high blood pressure and they never had an EKG done. It's so simple. The other thing is seeing what happens when they exercise. My favorite technology is stress echocardiography. There's no radiation, there's no dye. You do an ultrasound at rest, you walk the treadmill, you repeat the ultrasound, and you look at the walls of the heart. It can give us the size of the heart, the shape of the heart, the valves, the strength, what's your blood pressure doing, your heart rate doing. And then if the walls become sluggish, then it's a sign that there's poor circulation in that area.
Mm-hmm.
And so I have a low threshold to at least get some type of image, and maybe not even with walking, sometimes just a regular ultrasound of the heart.
Mm-hmm.
And it can be very enlightening because, again, pregnancy impacts the heart, hormones impact the heart. Could it be heart rhythm? So, that's where monitors now are very small and easy to put on, or people have their Apple Watch or their Fitbit. What is your heart rate doing? Is it racing? Is it irregular? What's your blood pressure doing? 80% of women over the age of 60 have hypertension. And all our guidelines now, hypertension, if you're in the 120s, you're getting too close to the edge. And if you're above 80, so they've lowered all the blood pressure readings so that hypertension is a lot stricter now. And so start measuring blood pressure, because if we're having that many issues with blood pressure, then we're missing a good opportunity.
Mm-hmm.
So I think that these self-monitoring things, and of course then keeping an eye on, your body composition, keeping an eye on your sleep habits. I mean, not everybody's going to get an Oura ring, but if you're waking up tired in the morning and not getting restorative sleep, you got to start looking at why.
Mm-hmm.
And so I think those are the biggest things that I tend to see. And of course, obviously, any swelling. A lot of women swell for different reasons, but if it's heart related things, there's some simple things we can do to check that. Women with breast cancer treatments, radiation to the chest, especially the left side of the chest, impacts the heart.
Yes.
The old radiation used to go up into the neck, and then we'd see carotid disease because of radiation side effects. But targeted radiation, chemotherapy, medication side effects, all these things can impact. And we've got a lot of people with mood issues on different meds that then create side effects that can impact how we feel and how our body feels.
Mhm.
So,
Yeah. Okay, so it's way more complex. So where would a woman start? She goes into a primary care doc, says, "Hey, I'm not feeling right."
mhm,
And I have some family history. My cholesterol's on the edge. And they said, "Okay, well, fine, we'll do your blood work and give you a tablet." That's often the extent of it. Now, I'm
yeah,
a little bit playing devil's advocate here with you because that's what that's why people often come to me, is because they say, "I've tried to get a workup, I've tried to get help, and nobody's listening." So
yeah,
what they want to do is put me on a statin, and if my blood pressure is minimally elevated, an ACE inhibitor, because that meets insurance criteria. Then
yeah.
the box is ticked literally for the physician as being compliant with insurance guidelines, but that doesn't mean that the patient's cared for.
No,
We've got this weird thing going on here.
there's a real dynamic now with medical care, and it's many people are coming saying that they're just not getting, they're not even able to get their story out. And it's really frustrating.
Yes.
It puts more onus back on the patient, which is really tough because a lot of people just don't even know where to go to look.
Yeah.
And sometimes if I'm very busy on call, I'll tell people, listen, you have to get this book or check out this website. And sometimes that's all we can do, is try to educate what to look for. And I think what you're doing, Mary, with your education here is phenomenal, because people then can seek out,
Mhm.
what can I do that's different than just taking this pill? And
Yeah.
of course, the network of people doing health related things doesn't always have to be a physician. Yes, if it's a medical issue, but can you get in to see a nutritionist, a health coach, a naturopath, a chiropractic provider, to at least work on the basics?
Yeah.
But the most important thing is, I think really primary care providers really try, is if you are not feeling well, you need to be persistent and find someone that listens.
Yeah.
Because even if they get you into a specialist or someone that can at least do some basic things, that's reasonable. But a
Yeah.
lot of chronic illnesses just doesn't fit into that category. But you need to be persistent. If you're not feeling good, there's a reason.
Yes.
And that's really important for people.
Yeah. So
Yeah.
what I'm hearing you say is advocate, advocate, advocate for yourself.
Yes.
And if your doctors or your provider's not listening, find someone who will.
Correct.
So a woman could ask for an EKG.
Yes.
They could ask for cholesterol panel plus inflammatory markers, which would be
Yes.
a highly sensitive C-reactive protein, homocysteine. There are lipid, you've got the balance between omega-6 and omega-3. Those
Mm-hmm.
can be gotten at regular labs, like Quest has that. I'm not sure what
Mm-hmm.
LabCorp has. We're running a special right now, and yes, this is a commercial break, on the Boston Heart. We put together with them a specialized panel, a care and
Mm-hmm.
wellness panel for cholesterol that looks at absolutely everything. It's the most advanced panel on the market.
Well,
And
and I tell people, it just sometimes you have to look at the cost of that,
Mhm.
may be the biggest difference, because it may identify risk you never knew you had.
I have found more people who had elevated cholesterol, but it's not because they made cholesterol in the liver, it's because they absorbed it through their diet.
Yes.
And it explained why a statin really didn't impact them that much. And so
Right.
we had to use a different medication to bind up the cholesterol that they would just absorb like a sponge.
And the other thing I think for a lot of people, if they're hesitant with these medications, is then I go back and tell them, listen, you really have to work on your foods. You have to get more fiber any way that you can get it. Because if you're constipated for 4 days, whatever we do is not going to be effective
Right.
until you kind of work through that.
Yeah.
The other thing that's readily available through any lab is ApoB.
Mhm.
So ApoB is attached to every bad cholesterol particle. It gives us a snapshot of risk. The other thing that's available through the regular lab is lipoprotein A.
Mhm.
Lipoprotein A frequently is a risk factor that's never checked.
Mhm.
People can have a completely normal cholesterol panel and their lipo-A is elevated,
Mhm.
but their ApoB is also elevated. So that's one of the things that makes those two nice to get. And lipoprotein A is very different treatment than trying to lower cholesterol. And it's a very high risk of heart disease, stroke, blood clots. And we can sometimes see, we know aortic valve disease with that. We don't know all the connection. And the
Mhm.
higher the level, the more the risk. And I would refer people back to the Bale-Donine book, Healthy Heart, Healthy Brain. And there's some really nice descriptions in that book for people that want to read about these risk factors.
So then the question, I'm just hearing it right there. I'm hearing everybody stopping for a minute and going, okay, so then why don't these routinely get tested? Why do you think that is as a cardiologist?
I see people coming in now that have had no lab tests done
Mhm.
for a couple of years.
Yeah.
Part of it is availability to get into their primary care. It takes time to fill a lab slip out. And then if you don't know what to do with the results, why would you want to order it? And so part of the challenge is the training that happens currently does not always involve some of these more advanced lab panels.
Mhm.
People just look at the cholesterol, look at the blood sugar. Well, that's okay, but you miss a lot of risk. If your hemoglobin A1C is normal,
Mhm.
considered normal, you still could be, metabolically imbalanced.
That's correct.
And it is a time-consuming thing to order the lab, have the patient get the lab, then they need a visit back, and then you have to know what to tell them. And that takes time. And I see this as a time-pressured environment of not being able to spend the time that it takes to educate and guide the patient. And that's why it becomes even more important to widen your team, not only to include yourself and hopefully educate your family, your community. For example, Mark Hyman, who's in charge of the Cleveland Clinic Functional Medicine Clinic, did a large program through the Saddleback Church out west. And they had, I think, 50,000 people go through a lifestyle program.
Mhm.
So what they did was they showed the church how to do group visits, cook together, learn about what to do, and it was able to impact a large group of people. That is going to need to be the future, is going out into the community and really trying to get people on task with taking care of each other and yourself.
Mhm.
So I think that's going to be the key. So if people need these lab tests, they're going to have to search out people that'll do them. And that's where functional medicine or American Holistic Society, the International College of Integrative Medicine, these are groups that are able to provide, and people may have to say, I need to take this savings to put forward to do this with someone as part of their care, even if it's not all their care.
Right. Yeah, because I think, so your office, I mean, just to be clear, do you participate with insurance?
I do. My
Yeah.
partner, Dr. Posset, who owns the practice, he is completely cash-based, does a lot of very innovative treatments. And I am currently cash-based, but it's challenging. It's a different conversation.
Yeah.
And eventually I may have to back away from insurance because of that.
Yeah.
But my goal is to try to develop affordable programs for people to start to really look at the bigger issues. It's really hard one-on-one in
Yes.
an insurance-based practice, but I do take insurance, most insurances, and I try to make it efficient. And it may not be everything with each visit, but at least it's something.
Right. And that's what, yeah, for years I took insurance and then for a period of time I didn't. And it was really this issue of time, what I needed to do to literally make the practice work because of the employees I had, my overhead. I mean,
Yes.
it's business, right? And you have
Yeah.
to be able to keep the doors open to be able to do what you're doing. And so now with the amount of education I do, because physician really means teacher, right?
Yeah,
The amount of teaching that I do, there's just no way I can get reimbursed for it, and do
yeah,
the same amount and have the impact. And so we're also developing coaching and classes. Classes, I'm not sure is the right word, but group setting or mastermind settings where people are really working by digging into their genomics together, where they're
yes,
looking at maybe there's a subset of people that have cardiovascular disease, or other folks, it's the gut brain or the gut emotional axis that we're really working on, or some folks with autoimmunity. So we come together and share our experiences and figure out a way forward by supporting one another. And I agree with you fully that that's the way forward, because I think with all of the things we have in medicine, if we had cracked the code, we wouldn't be still with heart disease as the number one issue.
right,
We still wouldn't be where people have 85% metabolic syndrome, diabetes, metabolic inflexibility, as you talk about. And, and then right on the heels of that is the obesity epidemic, and now the mental health anxiety epidemic coming out of the pandemic. I mean, I'm not sure where we've really done ourselves any favors with our current model that's in place for medical care.
right. And they're understaffed, which is really challenging. So I think that there's a lot of dedicated people hanging in there.
Yeah.
And I think it's important for people, again, just to try to do what you can to take care of yourself.
Yeah.
That's the key. And there's enough resources that are available with
Mhm.
what you're doing. I mean, you can learn how to cook for free online now.
Right.
And it's always more fun to do it with someone in the kitchen.
Hmm.
But there really shouldn't be any excuses anymore. I think we have to say, you know what, I gotta just really, when I can, reach up and do one thing today that is a healthier thing than what I did yesterday.
Yeah, I think that's an excellent, and I think hearing you say there are no excuses because there is so much information available. The
Right.
key is finding a trusted professional, such as a physician, a
Yes.
specialist, somebody with a medical license and training, even if that's a nurse practitioner or a physician assistant that has full unrestricted scope of practice, that they
Yeah.
really, because that means depth of training, that means broadened knowledge base, that means a deeper knowledge base. And health coaches are great as they become a part of the team.
Yes.
Nutritionists are great as they become a part of the team. But the team has to work together and really be driven by proper, I'm going to call it clinical principles and
Yes.
accurate research and accurate findings, rather than like selling a stack of supplements or programs that people get down in but really don't get the results from, and that are front loaded and then just overwhelm the individual.
Mhm.
It's a matter of meeting them where they're at. And then even just bringing in the whole concept of that emotional trauma, the concept of what they grew up in with what happened to them and how that affects their heart. I mean, we haven't even touched on the emotional concept of heart attacks or heart disease and how that weighs on people. Because that is one of the things that has to be addressed for them to be able to change their motivation to even care for themselves.
Yes.
And that requires a team approach as well.
Absolutely.
And looking at the mind body connection and looking at how globally we fit within our community and one to another. I mean, so heart health could be not only the individual, but the heart health of the community, of the world, of the planet, you could really expand philosophically on all that. And it's really, are we even heart-filled people? Are we living from our hearts? Are we living from anger? Are we living from frustration? Or are we really heartfelt and really taking things to heart to live that way? Because, the body has the inherent capacity to heal. If it didn't, none of us would be here this long. That's for darn sure. The body has carried us around a long time, even if we haven't done things as maybe well as we should, or well intended as we should, or whatever. So coming together, bringing that heart back into it. I guess what I'm hearing you say is, really, really spend time learning and knowing your risks.
That's the first step. And I think the second thing, because especially all ages, people don't know quiet. They're constantly stimulated. They're being pulled from all different angles. And I think that as fun as that can be, you have to find that still point, the quiet thing, to bring everything together. Like what you had talked about in a recent podcast is sitting out under a tree.
Yeah.
You know,
I did that this morning, same tree.
That's nice. And Stephen Sinatra talked about this. He's unfortunately passed now, a wonderful integrative cardiologist, talked about earthing, just being outside, digging in the soil, going out barefoot. But it's the quiet.
Yeah.
And that's the moments where you have to say, do I really need to do these 50 things today? Or can I take a moment to go in the kitchen, make a good meal, go for a walk, spend time, with a pet? And that's what Dean Ornish really found with the group support and the meditation and the yoga, is kind of finding whatever brings you joy in the quiet or prayer, and allow the heart to take a breath.
Yes.
Yeah.
Yes. So heartfelt living means setting a pause button.
Yep.
And it means connecting with your heart, connecting with your soul, connecting with the things that make and help you find joy, and then working with someone who understands healthcare, medical care from that same level. That's what that sounds like.
I think we fixed it.
Yeah. Okay.
Now we have to just get people to and I tell people that, it can be overwhelming. And you have to laugh about the mistakes you make or the things you do. And it's just, it is life, and life throws us a lot of loops.
Yeah.
But it just has to be something that becomes more important. So I like to tell people my job is to hopefully wake them up and also give them some direction.
Yeah.
So they don't feel so overwhelmed and lost in the medical field.
Well, I know you're doing that. It's not just something that you're saying here for the podcast. I know that's how you live and how you practice. And I think that, thank you for that, for being in that space for us as patients and being who you are, to bring that right into your profession, and then being able to share that with as many patients as possible. So I'm grateful for that. I'm thankful for that. And I know that, you said at the very beginning of the podcast, I'm different. I would put you in the rare bird category. I would keep it, I would reframe that and say that's a rare.
I want a large plume on my head. Okay.
Exactly, for sure. Because I think, patients respond to that. It's that connection. Yeah. And I think the more we can find folks to connect first with themselves and with another person or a group of folks that are going in the same direction, the more I think we can find an impact and even create a critical mass and change things. So I know you and I have the same goal of nothing less of changing healthcare and affecting as many folks as possible in a positive way. So I thank you, Dr. Alicia Williams, for your time today, for your expertise, for your heart and soul that you share with us. In California, they would do this. So in Michigan, we'll do that too, Yeah. And I thank you very much from the bottom of my heart for sharing with us today and bringing your knowledge and passion to our podcast, since you put it that way. And I would just put an open invitation to invite you back at some time in the future.
Thank you. And I think it's fantastic what you're doing with your education and reaching out to people. I know I'm an avid listener, so
Oh,
I'll
thank
be
you.
looking forward to the next podcast.
Yeah, good, good. Now,
Yeah.
when you listen to yours, listen with an open heart. Don't be critical. It's
Yeah.
we always
I
sound
know I'm
funny.
goofy looking, so it's okay.
We all are on the
I
screen.
know.
All right. Well, thank
Thank
you for your
you.
time, and I hope you continue to enjoy your day today.
Thank you. You too.
Thank you for joining us on the Since You Put It That Way podcast. Today's episode was written and produced by Crowded Table Productions. Technical editing, Malin Long Lopes. Sound editing, Jonathan Fiegel. Music, The River Jordan, written and performed by May Erlewine. Please rate and review our podcast as well. We appreciate your feedback, and hey, be positive, share the love.